In this last segment, we want to review what we've talked about up to this point and to go over some common questions that people have. So if you recall, we talked about where your health comes from. We talked about brain to body communication, how important that is, and how important a properly aligned spine is for proper brain to body communication. And then lastly, we talked about strategies of how we can work together as a team to get the best results possible. So now let's go ahead and move on to some common questions. And I would say one of the questions we get quite frequently is, how does a person know if their spine is out of alignment? Well, as we talked about earlier, body imbalance is a good indicator that you're out of alignment. So we said when the upper cervical spine misaligns, you're often going to get a compensatory change in your body. So you'll get an unequal shoulder height, unequal hip height, unequal leg length. So if you notice that on anybody, that's a very good sign that they're out of alignment. Another sign would be is if they feel like they have to pop and crack their own spine a lot. If your spine's in alignment, the joints are moving right, you should not feel the need to pop and crack your own spine. And we certainly recommend that you don't do it. That is just a sign that your spine should be checked by a chiropractor. And then lastly, obviously, if you're having a problem, if you're having migraines, vertigo, dizziness, stomach problems, bowel problems, bladder control problems, almost anything, because the nervous system controls it all, it potentially could be caused by a spinal misalignment. We want to correct the cause of the problem, not just cover the symptoms. So if you're having some symptomatic problems, we'd love to check you and see if you're out of alignment. Another common question is, well, what about kids? Do kids need chiropractic? And the short answer is yes. Kids have a skull, a spinal column, and a fully functional nervous system, and they can misalign their spine just as easily as an adult can. By the time a child learns to walk and falls about 50 times, to rolling off a bed or changing table, to crashing their bike, to sledding accidents, skiing accidents, playing soccer, playing football, doing gymnastics, all these jarring and jolting activities can potentially cause a spinal misalignment. Sometimes even a difficult birth process where they're pulling and twisting and turning the neck can misalign a baby right there on the first day. And if you're out of alignment your first day, just think what your decreased health potential is for the rest of your life. So we like to check children to make sure that they are in alignment, and then periodically throughout their lifetime to make sure they're maintaining that correction. So yes, children should be checked. Another common question we get is, well, what about exercise? Can I exercise? By all means, you can exercise within your body tolerance, but there's a time and place to exercise. So as a new patient here, usually in the first 30 days, we are not going to recommend exercise because we don't want you exercising when your body's out of balance or you've got something injured or festered. So we will let you know what exercises can be done and when to do them, and we want to make sure that you're healed up to the point first where that's acceptable. Another common question would be, well, what about maintenance care? I've heard the saying, hey, once you see a chiropractor, you always got to see them. Well, how frequently you see a chiropractor ultimately is your decision. Initially, we're going to come up with a care plan to try to help you get to the highest level of correction and function the best that you can. After that, because we're mechanical, we move, we jump, we exercise, we do things. There's potential for spinal misalignment that has to be corrected and maintained from time to time. So, how frequently that needs to happen is going to vary with every person. Some people can hold a correction for years at a time. Some people can hold it for months at a time. I've got a few people that can't even hold it a month. That would be rare, but it does happen. So how frequently you need a tune-up or a maintenance visit, we'll try to help you determine that, but from time to time you will need maintenance. Another common question that people ask is, I'm afraid to go to a chiropractor because they're just going to twist and turn or pop or crack me. Well, what you have to understand about chiropractic, just like in medicine, there's different specialties within each field. So in chiropractic, there's many, many different ways to correct spinal misalignment. Some ways are more forceful. They do twist and turn and pop and crack. And then other ways are very gentle, no twisting, no turning, no popping or cracking. Here at this office, we specialize in the gentle ways. We don't have to twist or turn or pop or crack to make a correction. So bottom line is there's different types of chiropractors, there's different techniques. Maybe you would prefer one over the other, and that's fine. So we would recommend choose the technique that you're most comfortable with and that you get the most results with. And certainly don't let a doctor who's not a chiropractor tell you to never go to a chiropractor. I don't like that when other doctors who do not understand what we do try to tell a patient, hey, you should never see a chiropractor. Let your medical doctors give you your medical advice. Let your chiropractors give you your chiropractic advice. So the bottom line is, even if you've had a spinal injury, sometimes we can make corrections above or below that can still get relief. So those are some of the common questions we have. You may have even more questions than that you're certainly welcome to ask our staff, ask myself at any time. But now that you've seen this new patient orientation, you know a lot more about health and chiropractic than the average person out there. So we're expecting you to help us spread the word. You know, there's many people suffering with migraines and vertigo and dizziness and many different conditions, and they just don't know what to do. They've been told they have to live with it, or they're just masking the symptoms with medication, when that doesn't necessarily have to be the case. So we would love to visit with anybody. We would love to offer a no-charge consultation to see if we think we can help. If we think we can help, we'll move forward. If we don't think we can help, we'll part friends. But help us spread the word if you would.